Hi, I'm Gio. I'm going to be, this is the supplementary video in regards to the initial fit test video that I've submitted. I'm going to go through the rubrics and then I'll make comments on my faults. So the first one was cover limitations of the fit testing. So the fit test is we're allowed to test tight fitting respirators only. So it will be for half faces and full face respirators. Some of the respirators, they're positive pressure, we can still fit test them on negative pressure. We cannot fit test loose fitting respirators, positive pressure supplied air respirators. And the limitations ought to be we need a specific room size to conduct the test. Humidity is affected, also affects. So if it's a high humidity in the ambient or in the place that we're fit testing, that may affect the fit testing as well. I'm just reading, set up the equipment and perform the necessary preliminary checks. I did not do the setup of the port account, but what I would normally do is about 10 to 15 minutes before the fit test, I would fill up my salt water cup, put a particle salt tablet in there, wait for it to dilute or shake slightly with the lid on. Then I'd turn my particle generator. It's in the opposite side of the room, unlike the fit test video that I've sent. And I will wait for 5 to 10 minutes. Then I will turn the port account on, get my software on, put the alcohol wick. I would wait for the software to start and I'll do my daily checks. Generally, most of the masks that we do are half-face respirators, so I would get my N95 companion for my P2 masks. And what the N95 does is it blocks the particles, so it only counts the particles that actually enter the mask through leaks on the seal. So this is why we need the N95 companion when we fit testing half-face respirators. I only fit tested a disposable mask on my video, but so we generally get the candidates to bring their half-face respirators with them so we can inspect and also give the feedback on the condition of their mask. Sometimes the mask, they've had the same mask for a few years, it starts losing the shape, the straps start getting loose. We can check the conditions of the valves inside the respirator, whether they clean it or not. You will know, it's really easy to verify that. If the mask is in good condition, then we, especially with the whole infection control and COVID measures, we tend to fit test them with the mask that they brought. We would just remove the filters and put the P3 filter on one side, put the adapter on the other side, and then attach the P3 filter, and then we get them to conduct the test. We do get them to have a look at the mirror when the mask is when they have the mask. I first get them to ask if it feels okay, feels comfortable. Then I get them to look in the mirror, and then if it's off center, it just gives a chance for them to readjust before we start the test. I also had one about the probe the respirator. So I like to probe the respirator around the mouth and nose, and this is because it obviously allows for a constant airflow. In many occasions, I've seen masks that are probed on the sides and it touches the skin and blocks that airflow. You can hear that the port account starts struggling because the tube is blocked. Sometimes that leads to, if you're not familiar with the device, that may lead to a false positive. So it blocks the air. The port account starts counting it stops counting the particles from inside the respirator, which can be interpreted as a false positive. Generally, you're gonna have a warning on the video or in the screen or on the port account itself. But if you don't know to read these signs, then you may get a false positive. Okay, so and also another thing is if you put the tube on the side, that tube, when they start doing the exercises, you may pull the mask slightly down or sideways, so it might move the mask depending on the mask you're fit testing. So if it's centered, it's just a little bit easier to keep it in place and not affect the mask. Changes of facial characteristics that prevent a seal. So that would be if someone has gained a significant amount of weight or lost a significant amount of weight, or perhaps had change in the nasal, in the bridge of the nose, or if they have had major dental. Depending on the mask that they use, that can affect significantly. The mask can suddenly be too small or too large for the person, or the nasal, or they may have significant gaps on the nose piece, which may lead to a fail. So if that has happened, we generally recommend them to retest, and it's sometimes just a matter of getting a smaller respirator. Daily checks or fit checks, sorry. So put the fit check every time the person, what we recommend is if they have to, if before they are exposed to the hazard, they'll put the mask and they do a fit check with each time they put a new mask before they get exposed to the hazard, before they're exposed to dust or etc. It just gives them the chance to readjust the mask and feel more comfortable with it before they actually get exposed to the hazard. Cover conditions under which the fit test would be stopped. Sometimes when there's low ambient, there's port accounts that if depending on the setup, you can choose for the test to automatically stop if they have consecutive fails. I like to leave that on because it's educational for the person to see that even though they're wearing the mask that they like or they think that they're protected, sometimes good to show that that's not, that's not providing them with a good result. But also if there's low ambient concentrations, the fit test will stop. You get a warning message and then it'll stop. And sometimes it's just a matter of soaking the alcohol wick, so removing the wick off the port account and soaking in the alcohol receptacle, or perhaps getting a new wick and then restart the test. I generally see that happening when the fit test has been running for a few hours of a busy day of fit testing. I start getting low alcohol, and it's generally because the wick is a little bit dry. So after the fit test, we can generate a fit test record. So the fit test record, if you do consecutive masks, you can choose to generate a multi-respirator fit test card. So to have the person's name, the protocol that the person is being fit tested with, and also the expiry date and the protocol that's been used for the fit test. So this will be obviously the fit test pass level for a half face mask will be 100 and 500 for a full face respirator. Following the test, I'll just give them a general overview. I like to show them the screen where they passed or failed, and go through the results, when they need to conduct the fit test, the requirements for facial hair, and maintenance of the mask and cleaning as well. I'm just going through and seeing quickly, so I'm within the 10 minutes. The comfort check. So most of the individuals that come to us, they're already familiar with the mask that they're using. But what we have is generally we have 3 or 4 types of masks, and we get them to just hold the mask and put it on, seeing which one they feel comfortable with. And while we're fit testing, we get them to put the mask on while we're adding their names and the details into the port account, and then we start the test. What else have I? HS considerations. I think I've already said that we tend to disinfect the masks, and obviously we advise them that they're supposed to use only the mask that they have been fit tested with, because we can't guarantee that any other mask will give them that exact protection. So we advise them to only use the mask that they have been fit tested with, which is very important because unless they've been fit tested for other models, we can't really guarantee that they have that exact protection. So and I'm not sure. I think I've covered everything. Thanks, Mark, for letting me send you the video a bit later, and hopefully that's enough. But I'm happy to do a fit test with this reusable mask and send it through to you next week as well. Thank you.